of our community. Here's the hard truth. In 2016, a study published by the Center for Disease Control and Prevention found that people living in the poorest neighborhoods, Black and brown Americans, during the regular flu season were hospitalized in connection with the illness at a higher rate than residents from more affluent communities. Black and brown Americans find themselves at the front lines of this pandemic. Among the American workforce, just 16% of Hispanic workers and 19% of Black American workers are able to work from home, while 30% of whites and 37% of Asian Americans can. For Black and brown workers, the choice is simple but devastating. Go to work and risk exposure to COVID-19 or lose a paycheck, a job that you desperately need. Recently, the CDC released state data that's shaken me to my point of tears. In the state of Michigan, Black Americans make up 14% of the population, but 40% of its COVID deaths. In Chicago, Black Americans make up 30% of its population, but 72% of the COVID deaths. In Louisiana, similar numbers. Black Americans make up 33% of the population, but 70% of the COVID deaths. The fact is simple. We are dying more because our bodies have borne the burden of chronic disinvestment and chronic disenfranchisement. All this institutional racism and the cascading effects on our health outcomes have given us all the pre-existing conditions that make this disease so deadly. So once we are affected, we have more severe outcomes. All the data about social determinants of health from the CDC, the Center for Disease Control, and the WHO, World Health Organization, all point to this fact. Black Americans are treated differently when we go to the hospital, and we don't have the same access to quality health care in this country. Even our access to quality health food has continued to be an issue, dating back to the early 1900s. We know this phenomenon now as food deserts. As we speak, community members are homeless, living in extreme poverty, disabled citizens. Protocols are a moot point when running water can be a challenge. Social distancing will not be possible for our community members who find themselves in city shelters or densely packed public housing. Getting medical needs met for our seniors and physically challenged present a whole host of issues for individuals without the means for transportation, as buses and trains run on limited schedules and hospitals scramble to meet the rising demands. These conditions have led to a deadly spread of this disease through Black and brown communities throughout our country. I've been in close contact with public health officials, homeless advocates, city and jail personnel, housing officials, and advocates for low-income communities. And this concern grows as we learn more about the pandemic. Contrary to popular belief, our community operates as a close-knit group, connected in ways that most could not comprehend. This cultural feature has allowed us not just to survive in circumstances, but to thrive sometimes. We must be committed to join this fight and continue to provide services that we can during this difficult time and help our community. But the focus needs to be the long game. As we all wait for the federal response to address some of the economic hardships for individuals and families, we need to commit to assisting our vulnerable community members and identify some short-term solutions while Washington figures out their response. But we also need to be playing the long game. The City of Boston response has been adequate, working on halting court order evictions, deep cleaning in our public housing developments, but this is not enough. I will repeat, strategically, we need to be playing the long game. The entire country needs to use this moment to readjust our perception on service delivery to our most vulnerable. This is an opportunity to right these wrongs and create a system that we can use during this current crisis and beyond. If and when we encounter new waves of COVID-19, we'll have a system that ensures an additional safety net for our most vulnerable community members, and at one that addresses all the inequities. This is a chance to really take a look at ourselves as a country and ask, how did we get here? How do we respond and take care of the most vulnerable? And the most important and vital question of all, what does justice really look like? Thank you. I'd like to introduce our panel members tonight. Super excited to have them. We have Dan, who is an ICW graduate, Jermaine, who is an ICW graduate, and Jamari, who's a current student at ICW. These gentlemen out in the community, business-minded entrepreneurs, hardworking community members. So we're super excited to have them. We also have Jessica Jackson here from Reform Alliance. Super happy to have her. She's a human rights attorney who began her career representing men and women on California's death row appeals. Jessica currently sits on the Committee for Fair Judiciary and represents Congressman Jared Hoffman, on the Democratic Control Committee for Marion. In 2013, Jessica became the youngest elected official and served as mayor of Mill Valley. In 2017 to 2018, and currently serves on the Mill Valley City Council. Jessica has a BA from political science and also a doctorate from Santa Clara. She received the Dean's Outstanding Student Leadership Award and now serves as the Chief Advocacy Officer for Reform Alliance. So thank you, Jessica, for being with us. Appreciate it. Gonna let her say a couple words, and then we'll get to the Q&A. Jessica, it's on you.
Well, it's always somebody reads your resume to you, your bio, you're like, oh, that's true, I've done a lot of that stuff. But none of it is as impactful or as meaningful to me, this issue, as the personal experience that I had. When I was 22 years old, I found myself standing in a courtroom in Georgia. I didn't have anything but my GED, hadn't been to school, certainly hadn't become an attorney yet at that point. And I just had my 2-month-old daughter with me. And I stood there and watched as my husband was sentenced to 15 sort of 6 for he had committed. And it completely tore our family apart. And since then, over the last 15 years, I've worked really hard on, trying to make sure that that same thing doesn't happen to other families like mine. And I think these last 6 weeks have been very, very heavy emotionally because, I talk to a lot of people who are still inside. I try and spend as much time as I can talking to families, talking to people inside. So I'm staying close to the issue. And we've had so many people reaching out, just terrified that their loved ones aren't going to make it. And that people who went in for a drug sentence or who went in for, a theft, that they're going to end up with a death sentence. So I'm really happy you guys are covering this issue. I'm happy to speak to what's going on inside of our prisons and jails right now with COVID and what the response from Reform has been. We've been working with governors across the country to try and make sure that people have access to equipment that people out, that we're able to actually create some space for people to socially distance inside of our jails and prisons, and that we're also taking care of their mental health as well while they're going through this, because it's extremely scary, and that they're able to have some contact with their family even though people don't have visitation right now. So happy to answer questions on it, but I'm just really excited to have the opportunity to talk about this important issue, and that you guys aren't letting people inside be forgotten in this moment.
Appreciate you, Jessica. Thanks for being here. We really appreciate it. I have I'm going to start off. We're going to start the Q&A session. So I'm going to start with a question to our esteemed panelists from ICW. I'm going to start with Dan, and we can go to Jermaine after. But the question is basically an open-ended question about how COVID-19 has affected you.
Okay. How you doing, everybody? First of all, how you doing, Laurie? Well, I mean, it's affected me and my family in a lot of different ways. A lot of people that I see around me. I know of a lot of people that have passed. I have 3 family members, myself, 2 aunts, and 1 cousin that was infected. They're doing good, thankfully. And I know of a lot of people that's incarcerated as well. And sometimes just looking at it, I mean, as far as it's affected me in a lot of different ways, financially, and the same as everybody else as far as losing loved ones and then extreme boredom, you know what I mean? And just running around and just trying to take care of everybody, make sure my kids and everybody is good, and my mother, make sure everybody is well. my grandmother. Just watching the world, though, just watching the people around you, the people in your community. A lot of people are just running around with this, yo, it's the end of the world type thing, you know? Just watching the people around your community sort of panic and watching the same homelessness, the same activities on certain street corners. And it's definitely discouraging to see what's going on with this. And that's how it affected me. Ultimately, it's just a little phase of discouragement, just try to keep my prayers up and keep my hopes up that everything's going to get better, you know?
Appreciate you, D. Jermaine, I'm going to pose the same question to you.
All right, so good afternoon, everyone. So how has COVID affected my family and I? Well, I would like to begin with my family in prison. It's a very trying time. I feel like there's no transparency. I have family right now that are in the feds, that are in Kentucky, you know, hundreds of miles away, and like they're when I do hear from them like once a month, he's so scared. It's like the fear is contagious. The stories are wild, and there's no way for regular people in society to get a real idea, a grasp of what's going on the inside, because when you don't have any visitation, you know, and you have a periodical phone call every once in a while, that doesn't suffice. Also, it's affected deaths now. Traditionally, you know, people bury their family and congregate, and the entire process of even just how they deal with the deceased has changed, and you're not allowed to have a funeral right now, and that's pretty trying on a lot of people. I think overall, just the fear aspect, you know, it leads to a lot of spreading of, you know, false information, and just some people are misinformed, and it's just hysteria. What else? I feel like it changes the dynamics of households here and abroad. You know, when you're forced to just be kind of around each other for all day, every single day, you know, it can either have a good effect or a bad effect. Financially, of course. I feel like there's two ways you can look at this. In 2020, we had World War III almost started, Australia was on fire, Kobe Bryant died, sports were canceled, everyone's sick, the world's on lockdown. You could throw Carol Baskin in there if you want. But then or you can look at it from an optimistic mindset and say, hey, there hasn't been any school shootings, you know, traffic's down, gas is affordable, you know, bills are extended, kids are actually home with their families being nurtured. Parents are home taking care of the kids. Fast food is being replaced by home cooked meals. There's more nurturing and integration happening right now within the segregation, if that makes any sense. So I think there's two different ways to look at it. I don't know. That's my answer though.
Appreciate you, Jermaine. Jessica, I'd love to hear your thoughts on how COVID's affected your organization, or you personally, or your thoughts going forward.
Well, I think, you know, personally, I'm blessed. I've still got a job. I've stayed healthy. I've got a house that we could all quarantine in safely. I am quarantined with a 5-year-old and a 16-year-old. So, you know, that can be kind of trying sometimes. But, you know, I count myself as blessed at this point. And as an organization, you know, our focus has been probation and parole reform. So in addition to the 2.2 million people who are incarcerated, there's 4.75 million people who are in some form of supervision. And those are folks who are kind of living on the edge of their seat, might end up going back to jail or prison at any given time, not always because they commit a new crime, but sometimes just because they miss a meeting with their probation officer, or they're late on a payment for their restitution or their fees or their fines. You know, if those same rules were applied to me and I was at risk of going to jail or prison anytime I missed a meeting, I'm late to meetings all the time. I'm late on bills all the time, right? And you know, it's a really rough sentence for somebody who's trying to make it and get back on their feet after having been through the justice system. So that's been our focus. We had 9 different state bills that we were working on passing. And, you know, we kept moving through March, and then COVID hit, and the state houses started closing down, and we started hearing from people who were inside who were saying, you know, let me out of here. I'm terrified. I might die. So we pivoted pretty quickly as an organization and started focusing on trying to mitigate and prevent the spread of COVID behind bars. Our policy director, Erin Haney, worked with experts from across the country to develop a 7-page policy plan. We were able to organize around it, get everybody from the American Conservative Union to the Urban League on board, supporting it, and then partnered with the National Governors Association to get it out there. And basically it calls for compassionate releases. You know, there are a lot of people inside of our prisons and jails, you know, who are there that aren't a threat to public safety, right? You've got people who are there just because they can't afford their bail. You've got people, like I said, who are there for technical violations, who, you know, could come home and have homes to go to. You've got people who have underlying medical conditions, people who are elderly, people who are in there for, you know, very minor infractions, people who aren't in there for minor infractions, but also could come home and would not be any sort of a risk to public safety. So that's in there, making sure that they're checking guards, because guards and staff are coming in and out every single day, possibly bringing in the virus. Shutting down non-essential courts, so making sure people who are inside are getting their court dates in their due process, but not having traffic court, not having a misdemeanor court. In fact, slow down the arrests. Like, there are a lot of things that people get arrested for or did prior to COVID that could just be a citation or a warning, right? So repurpose our police, get them more focused on getting elderly food, handing out masks, handing out, you know, information about how to keep yourself safe in this moment, not, you know, wrestling a child to the ground because they had tobacco on them, as we all saw in that video this week, or, you know, pulling somebody over for an infraction that they don't need to do that for. So, you know, we've got, I see somebody's sharing something. Sorry, I got a little distracted. But we've got a plan that we've been pushing out to governors. So far in this country, you know, we've seen 35,000 releases. Again, though, there's 2.2 million people who are in prisons and jails. 35,000 people might sound like a lot, and in fact, it's the biggest drop we've ever seen in our prison population. But there's so much more that needs to be done, and we've been trying to organize, get the media involved, and really get the grassroots pressures on our electeds, as well as just go directed to our electeds and say, look, this is what you need to be doing. Otherwise, the blood is going to be on your hands.
Thank you. Jamari, are you on the line?
Yeah, you can hear me?
Yeah, I'd love to hear your thoughts, Jamari, man. Let me know. How's it affected you?
Honestly, it's like, honestly, if you ask me, it's like, I wouldn't necessarily say, actually, it affects me in some type of way, but not necessarily fully, because me personally, I feel like it's like a myth. I feel like it's all a myth. I feel like it's some type of government type of mental thing, and I just feel like the people who was smart before it happened is going to survive in it, and the ones who really wasn't, I feel like it should just be like a wake-up call. But it's like a lot of certain, I feel like, I don't know, a lot of the way that they're going about it is just not average. I feel like if it was really something like killing people, like, I feel like it would have been, I don't know, I just feel like certain things would have been more serious. Like, if we was getting like life threatens or like bomb threats, people would have took it to a whole nother level. Like, you get what I'm saying? So I feel like personally, it's just more like a myth, because some people that I know that went inside, got checked in for corona, they've left the same day. There's some people who have like weird cases of it, they can still go home, but then again, there's certain people that die. And then I've heard rumors that there's really a care for it. I feel like it's just really to reduce the population around the world due to Black people. I feel like it's really trying to, like, you know what I'm saying? Because if you ask me, I feel like it's kind of proven, not fully, but statistically it's kind of proven that like there's more African Americans and like other African Americans, Asian, Hispanic, there's a lot that reproduce a lot. So it's just like, I feel like with the whole virus, I feel like, I don't know. And I also feel like after we was about to go to war with like North Korea, Russia, all this extra other stuff, in our reality, like, we can't really beat all of them. It's not a secret. We can't beat them. So you get what I'm saying? So they have an army and weapons just like us. So I feel like it's like a chemical war. I feel like it was like meant to happen to everybody, because like certain cases where it's like started at and it was high, they don't even got corona no more. So I don't be understanding how it be getting to like, I don't know, I be feeling like it's planted, and it's like it makes jobs slow for certain people. It makes like, you know, they let a few people out of jail. That kind of made me happy, but I don't know.
Well, I will say this. I think appreciate you, Jamari. I
Nah,
think
you
I
know,
think
nah.
I think Jamari's point speaks to something about. I think at the initial phase of this, I think there was a lot of stuff in the community about conspiracy theories and about things going around. And I will say this: one thing about conspiracy theories, like a good joke, there's always a little bit of truth to them. And what I mean by that is, um, you know, in my view, and this is what I was writing about here, was our lives in the community have been one big pre-existing condition, and that's why we're disproportionately affected by this. You know, hypertension, diabetes, high blood pressure, asthma, all these things that we disproportionately have put us in a position where we're affected by this in a very deadly way. So appreciate you, Jamari. Wanted to see if, and just throw it out to the chat, if anybody had any questions. Would love to field some. If not, I'd love to.
Felice,
Yeah.
we had two people ask the same question, Marion and Maria. So I think it's probably directed toward Jessica, but they're wondering, you know, what kind of support systems are in place to help people who are released early.
Yeah, that's a great question. So the releases have been done sort of in a different manner depending on the jurisdiction, right? So some are counties releasing people from jail, some are states that are releasing people out of state prison, some are, you know, the federal. I think we've seen 1,800 people. In the federal, I'll say they have been checking on home confinement reentry plans. So they've been requiring that everybody have a reentry plan. They've been doing virtual video visits to see, you know, do you have a house that you're going to go to, and checking that through the person who will have them on probation. Some states like California, they let out, you know, 3,500 people who would have been released anyway in the next 60 days. So those folks, you know, had a reentry plan as well. I think we've seen more of an issue with jails, and unfortunately there have been some cases of recidivism or alleged recidivism so far with some of the folks who were let out of jails that I think will impact ultimately our efforts to get more people out. But the problem is, you know, a lot of the reentry services that we normally see that are normally up and running aren't able to run right now. And I think for long term, we're going to see another issue, which is we've had really, you know, good economy. We've had a very low number of unemployment. So one of our biggest arguments to get people out has been that employers need more of a workforce. So it's been a second chance workforce. It's been second chance hiring has been a really big push. But now we're going to see so many people who are unemployed that it's going to be harder, I think, to find jobs for people who are coming home with records. So I know a lot of the advocacy orgs are pivoting and really trying to focus on reentry and how can they be supportive during this time when you literally don't even have, you know, housing that you can offer people. People can't go down to Goodwill and get the supplies that they normally were getting. They can't go to AA meetings. You know, everything is really shut down. And, you know, a lot of people, unfortunately, C3s, our nonprofits, are not going to be doing as well because people aren't going to be able to donate as much money, and nonprofits run on donations. So very good question. I think there are some very unique challenges around reentry that are coming up right now because of the virus.
Appreciate that, Jessica. I'd like to pose that question. I think it's a very interesting point about, you know, community members being released back to the community and what that means for the homes they're returning to, but also the community in general and some of these cities. So, Dan, I'd love to pose that question to you. What are your thoughts about guys coming back into the community based off of COVID releases?
I mean, well, my ultimate thoughts, I mean, is me being me being formed, you know, previously incarcerated before. I'm long away from that now, but I mean, ultimately, just knowing how everybody has just, you know, chose a certain path or made a certain wrong to lead them into incarceration, but how it can deter your life, it can take away from your life, it could just, you know what I mean, sort of make more of a mess of something than making something greater. I mean, ultimately, I'm glad that a lot of fellas are coming home. How is taking its toll on the community? I mean, that can go a bunch of different ways. You know what I mean? Honestly, I focus my thoughts on when you see what's going on in the community, and then you don't see any police on the street. You know what I'm saying? Like, and then they say there's a lot more crime going on. You know what I mean? What's already been going on, even previous to the virus, is just gonna be a lot bigger, a lot greater. I don't think that it's a real effect on the fellas that are coming home, and but it still leads them into a situation where they don't know what to do. I mean, when we come home, regardless of the coronavirus, you know what I'm saying? When a lot of guys are coming home, you're lost. You know what I'm saying? Whether your family lives in public housing or even on a general lease where they're accepting some type of assistance from the state where you can't have your name on a lease and you can't be certain places, and sometimes there's just nowhere for you to go because a lot of our homes are already overcrowded and underfunded. You know what I'm saying? It's not a lot of food to eat, and as Jessica spoke about, as far as you know, gaining employment, that's always been hard on fellas. Getting into a living situation, getting an apartment, you know, even regardless of the money, even if you had a big grant that somebody came and helped you out and gave you the money, you know, it's still it's gotten a lot further into the credit scores and queries and backgrounds, and landlords aren't wanting that there. So, guys coming home, and of course it's just a lot worse because you don't have a lot of the services for whether it's anger management or certain things that guys have to attend to, you know, drug treatment programs or things of that nature. You know what I mean? We just don't have the services anymore, and a lot of people are not too familiar and even attempting to do a lot of this the video chatting, the video training as we've been doing. You know?
Appreciate you, D. Jermaine, I'd love to ask you that question as well. How do you feel about how the community would be affected if a large number of community members came back from incarceration?
I feel like I'm under the impression that anyone, as was just mentioned, anyone who's coming home, you're vulnerable and you're in need of services. Pre-COVID, you can have a whole game plan ready to come home with, and you know, it's one thing scrimmaging and it's another thing actually playing in a game. So it's like you can have the purest intentions and you come home and there's just one variable that's off and it can like change the whole entire equation. And it's like when you have a lack of support already, and now you're trying to return to society and make something of yourself, it's really difficult to expect me not to sell drugs right now if I'm coming home from jail and I sold drugs before. Honestly, like if I just got out of jail for selling drugs, how long would you expect it to take before I sold drugs again? If I had nowhere to stay, like you said, my family's homes are overcrowded. People are going to be reluctant to be able to take me in because of all the COVID in the jails. Like, it's just, you know, there's so much going on. It's like that's a really good question.
No, I appreciate that comment. I think that leads to a larger point around, you know, the lack of testing.
Yeah.
You know, you're gonna have guys coming home to community members who are super vulnerable, grandmas and aunts,
exactly,
and uncles and kids that, you know, without a sufficient testing, I mean, we're putting the community in another situation based off that as well. So, you know, I would love for that, Jess, maybe you could discuss that as well. Is there any is there any discussion about, you know, having rapid testing for guys coming out of the prisons, or is that at least a thought?
You know, there's some prisons are doing testing, like we just saw Marion Prison in Ohio. They did testing, and they did mass testing. They tested everybody in there, even if you weren't coming out for a release. And in fact, they found that out of the 2,500 people who were incarcerated there, over 1,800 tested positive. Some were asymptomatic, some were showing signs of sickness, but you know, that's all over 70%, which is crazy. And what we're seeing on the federal level, they haven't done a ton of testing. They're trying to get testing for everybody. What they do is they do a 2-week quarantine prior to bringing people home, but there's some issues there because they're quarantining people together. So, you know, if one of them has it, everybody's going to get it. But in the testing that we saw, and I think somebody posted this to the chat, we've seen 70% of the people who have been tested in the federal system have also had it. And then, you know, I did just talk to somebody at the governor's office in New Jersey who said that they're announcing that they're going to be testing everybody inside of the prisons. But this is not going to happen in every single prison in America or every single jail in America. And like you said, there's a delay on testing in a lot of cases too. So, you know, somebody might bail out before their test comes back. And I think it raises a lot of issues, you know, we don't want to keep anybody past their time, right? We want to get them out as quick as possible. But again, like, why are we even arresting people right now unless it's, you know, a significant risk to leave them out there and, you know, there's no other option. We shouldn't be arresting people right now and bringing them into the jails where they might pick it up and bring it back home once they bond out. So, you know, I think this is something that we have to keep pushing for all across the country. We need testing, we need tracing, we need, you know, less policing, we need less arrests, we need more people getting out of those facilities. The other thing we're doing is we've been sending PPE into the facilities because, you know, here most people have figured out how to get a mask or how to make a mask. I saw a YouTube video on how to turn a sock into a mask that, you know, looked pretty simple, but folks inside don't have that luxury and they're depending on us. I talked to one woman whose dad had made his own mask out of his underwear, which is technically state property. He could get a write-up for making a mask out of his underwear because he's destroying his state property, right? How sad is that? He's risking going to the hole to protect himself, but he's in his 70s. And so at Reform, you know, we worked with a bunch of different organizations and got some outside donors, and we were able to donate over 250,000 masks into prisons and jails. And I'm still hearing from people every day, like, my facility doesn't have them. Can you donate them here? So it's just heartbreaking, but there's so much more to do.
Appreciate that. I'm going to, a large part of this discussion is not only about grounding it in what is now, but really what we're trying to do is figure out what's next and how we're going to address the situation and how it not only exposes the inequities, but then allows us to maybe start to deal with some of them so that we're ready for the next wave of whatever. And so I'd love to pose that question to all our panelists. This is some of ICW's best and brightest. And so I'd really love to pose the question to you guys first about where do we go from here? How do we move forward, in your opinion? And what would you like to see done for the community? And I'll start with Daniel.
Well, where do we go from here? I'm trying to put my own plan together as well. So honestly, I just think, it's crazy because a lot of people there's tons of people that have been taking this time to get more creative in what they've been doing as far as like social media, and things of that nature. I know a lot of like different promoters, different artists, and a lot of people getting more in tune with their computer, social media, and attempting to make a business out of it or to make some type of lonely situation, you know. So honestly, I don't know, man. I think we just buckle up. I honestly don't know what's next, to tell you the truth, as far as like, you know, like how to get up out of it, or what are we gonna do upon it. I mean, just being strong. I think this is creating a lot as far as like social distancing and shaking people's hands and just watching, seeing how sometimes contagious and dirty people can be is awesome. Because I know a lot of people that's been feeling that way for a long time. As far as the whole mask situation is kind of scary when you look at it outside. So you wonder if this is going to be going on for like the next 10 years. Are people always going to wear masks now? You know what I'm saying? Like different people in different countries. So my mind's all over the place with it. I really don't know what to think. I just hope that we stay strong and we take something out of it. We learn something from it, regardless of how it's coming at us, government conspiracy or righteous time, nature, the plan. I don't know. Just hopefully we stay here. We get something out of it. We can figure out, people can get better on stabilizing their finances and get better financial control, being that you might not have a lot coming in now. Maybe this has taught you that lesson, just staying clean,
No, I appreciate that, D. Jamari, you on? I wanted
Yeah,
to
I'm
put
still
that
here.
question to you. Give me your thoughts on how we move forward, Jay.
I think moving forward with this whole corona, however they want to call it, I feel like yeah, stay clean. Always stay clean. That's number one. That should always be your mindset. To stay clean. But I feel like anything could happen. We could come out with a whole new virus right after this. So it's just like you never know what you really going what's really going to hit you. But at the end of the day, we know that there's people above us that control all of this. You know what I'm saying? We can only control what we God, but in reality, you know what I mean. So I feel like with that being said, stay clean and just find a better way to survive. So if we do go through this, it's just like it'll be like a normal process. Because I feel like at any time this could happen again. It might get normal to some people, especially if they feel like the people who was already surviving, if they feel like they got a good outcome out of this, whether it was investing in the stocks and buying businesses or like anything. I just feel like, just moving forward, just stay clean and you just gotta survive better at the end of the day. Cause this is just something that they just want to do. They could do whatever. Like I said, we could have a whole new virus within a month or two. But the whole wearing the whole mask thing, that kind of makes sense. In the next 10 years, are we still gonna be wearing masks? Is it gonna be like, yeah, I don't know. So really, you just gotta stay clean, and just survive. Like, ain't really too much with it.
I appreciate you, Jamari. Thanks. Jermaine, I'm gonna pose that to you. What do you think? What are your thoughts on moving forward? What do you feel is going to be important, or what are your thoughts on where do we go from here?
I'd say moving forward, I feel like we have an opportunity to really like revamp our approach on everything, like to hit a complete total reset button, and with every demolition, there's like the opportunity to rebuild. So it's like what better way to rebuild than on a foundation that's been smashed all the way completely to ruins and rebuilt from the ground up, as opposed to us trying to take a branch from this poisonous tree and make it fruitful. I feel like we have an opportunity to have some improv on our school curriculum, which has been damn near the same since like the 50s. The entire setup, I think we've grown redundant as a society. We need innovation. We need new techniques. And I just think there's no better opportunities than now. And I think, I don't know, just it's somewhere close in everyone's mind after recovery and health and safety, that should be on the forefront, especially education, period. Because let's be real, Belief, have they changed the curriculum much since you've been in school to the kids today?
No.
Don't they sit the same exact way, formatted the same exact way? You walk to the lunch line, you go, everything's exactly the same. And the statistics they're not ranting and raving about how great our BPS is doing. So, yeah, I think that's what I would have to say about that.
I appreciate you, Jermaine. Jess, I'd love to hear your thoughts on this. Like, where do we go from here? I know you're doing a ton of work with this, but would love to hear what you think. Where you think we could take these inequities and move them forward, and hopefully, as a country, get to a better place.
Yeah, I think I'm going to piggyback off what Jermaine said, because this is something I've been thinking about a lot. This is an opportunity. It's a terrible tragedy, but there is an opportunity in it, because at this point we're seeing state and local governments are going to go, bankrupt. They're going to need a bailout, right? There's going to be a lot of dollars that are coming from the feds to state and local governments to help them, because they've lost so much money. I saw something where Pennsylvania said they had lost $4 billion in their state budget just because of this shutdown, right? So they're going to need some money. Everybody across the country is going to be having their hand out, and that's going to mean that there's going to have to be a federal bill that gives some money to both state and local governments. And I think that money should not be free, right? There is a very broken system. There are communities that don't get what other communities get. And this is an opportunity to be in your Congress members' ears, talking to them about what your community needs are, right? The fact that we should have access to mental health treatment in every single community. It should be free. The fact that we should have access to jobs training programs and jobs placement programs in every single community. We should have drug treatment facilities and addiction facilities, right? We should have all of those key components. So there's an opportunity to say, hey, California, or hey, Massachusetts, or hey, Boston, we're going to give you the money you need to start getting back on your feet, but you can't go about business as it was before this virus. You need to be building this infrastructure so that every community can be safe. Every community can have the same opportunities that others do. So that is one thing I think people can do is, making a list. What is it your community needs? Get that over in a letter signed on to by all your neighbors to your Congress member. Tell them, look, when the opportunity comes, because that bill is coming, when the bailout bill for the states and local come, here are some things that my local community needs to do with that money and before they get any money, frankly. The other thing is, states and local aren't going to be able to, they shouldn't be allowed to incarcerate or have the same policing practices that they have. We should be making sure that police are getting a lot more training. We should be decreasing the number of arrests. We should be decreasing the amount of police violence against people. We should be decreasing, the number of people who are in our prisons and jails. And I think this is going to be the moment where we can make those demands.
I'm going to piggyback off that, and I love that. There was a question from the chat to the group about what you would say to our mayor of Boston, Marty Walsh, or Governor Baker about, what they should be doing as leaders in our state and in our city. And I'd love to pose that question to Daniel. I'd love to hear your thoughts, Dee, on what if you had a chance to say something to both of those gentlemen, what would you say about how they should move forward and what they should be focusing on?
Well, honestly, what they should be focusing on, I mean, what I would say to the mayor and the governor I would talk a lot about testing, making, just seeing to it that everybody is just safe, not just like the total shutdown. We're seeing a lot of people just roaming around, seeing a lot of people just out and about still. Let's get more testing going on. Let's focus tremendously. Let's get these teachers focused tremendously, because I got kids that are in school as far as the curriculum that's now being handed over through the computer for the last 2 months that they're missing in school. And then the continuing situation, we don't know how September's gonna attack us. You know what I mean? Making sure some of our stores are, filled up, because I just went to Danvers yesterday, and it's totally different out there. You don't see nobody wearing masks out there. They stop and shop, it's full. Everything is like on point. You know what I'm saying? In the neighborhoods, it's like a madhouse. There's no food on the shelves. There's real limited food, real limited supplies. Definitely no cleaning supplies. No hand sanitizer, nothing of that nature. The way people are being treated as far as their appointments and things of that nature, just like we have court dates and things of that nature, and things of that nature. Let's attend to some of the most important things. You know what I mean? Our elderly, our kids, the education of people who's incarcerated, their safety, you know, and testing.
Appreciate that, D. Jermaine, I'm going to pose that question to you. What if you had a chance to sit down with Governor Baker and Mayor Walsh? What would you suggest to them as the most important things to be doing going forward?
The most important things to be going forward. I think I would like to highlight. I don't know who's just mentioned that businesses moving forward need to like their infrastructure needs to prepare for future outbreaks and we need to do a better job of protecting our, how can I say, not to sound crude, but the non-essential members of the community, you know, like elderly and ex-cons and so on and so forth. It seems like, you know, who's getting slammed the hardest with stuff. But how, if I sat in front of them, what would I tell them that we needed to do? Man, they would need to give people like me more power to help them do what needs to be done. I think that would be my answer on that one. I don't think there's anything that I can tell them for them to do. They've been hearing that shit since I don't know, you can tell them to you blue in the face. Until people that are on the ground level start doing the ground level work, you're not gonna get too many results, I don't think. I don't know. Who's directly affected by this? They need to lead the charge, I feel like, in how this moves forward. The level of effectiveness hangs on the balance of that in its entirety. That's all I gotta say.
I appreciate that, Jay. I'm gonna take this opportunity to just thank Jermaine and Dan and Jamari for their time and for their thoughts. You know, I really appreciate it, man. You brought a lot to this discussion, and I'm just proud to be a part of this organization with you all, man. I really am. I'm gonna I'd love to have Jessica give some closing remarks. We're getting close to the time, but I'd love to, offer Jess the opportunity to talk about up and coming events of reform and what you got going on. And we'd just love to, before I say the last remarks, we'd just love to hear what's going on with reform. And thank you, Jessica, for being a part of this discussion. Really appreciate it.
Of course. Thank you guys for inviting me. I love this, that you guys have a community here, even when we can't gather. So at Reform, we're continuing to push to get as many governors as we can to adopt our SAFER plan. And by the way, Governor of Massachusetts hasn't done it yet. They've released, I think, 600 people, still a drop in the bucket. There's a lot more people who can get out. And there's a lot of people inside who need help accessing PPE and who need programming while they're on lockdown and who need to be able to access their families, free phone calls, that kind of thing. So I would say everybody who's on here, I would ask you to go follow Reform Alliance. You can follow me too, Jessica Jackson. I've got the link to our petition and our action center in my bio. So if you just click that link, you can get to our action center. You can sign the petition. I think we have like 12,000 signatures already. And you can also click to call your governor or your lawmakers so that you can be a part of calling on them and holding them accountable. The other thing is, we're continuing to push out as many stories of people inside. There's people inside who, when we talk about numbers, 300 people coming out, 600 people coming out, sometimes people out here get a little scared. They're like, what do you mean? Why are there that many people coming out of jails and prisons? But, it's really important to kind of get past that stigma, to start telling the stories of people who are inside, to start putting faces to their stories. And I'll close with one of those stories that I think really, today I was on a few calls about federal stuff and trying to really push them to change the criteria for home confinement. And every call I got on, I talked about a woman named Andrea Circlebear who passed away 2 days ago. And just 3 weeks ago, she became a mother and she was inside of federal prison. She came down with COVID and they had to deliver her baby by C-section while she was on a ventilator, and then she passed away. And, for the last 2 days, I've just, I can't get the thought of that poor little boy growing up without his mom, and needlessly. She was there because she let somebody sell drugs at her house, right? It wasn't a violent crime. It wasn't a crime that, you know, posed any risk to public safety. She didn't need to be put in a prison pregnant in the middle of a pandemic. And that's who we're fighting for. Those are the stories that we have to get out there and share. So I want to thank everybody who spoke on this call and was willing to share about your story. And I just want to say, you know, these stories are so powerful, and we appreciate all the support we can get, and we appreciate all the work you guys are doing as a community.
Thank you, Jessica.
Thank you.
I'd just like to say once again, you know,
Thank you.
I lost, you know, my best friend and his mom to COVID. And so, you know, I wanted to, and I know there's panelists who have lost people, and I want to make sure that, you know, this conversation is dedicated to those individuals. And I know we've been all rocked in a certain way. So I just want to just make sure we make that very clear, man. This whole conversation is dedicated to community members who are gone, but not forgotten. Thank you to PUMA. Thank you to Reform Alliance. Thank you to ICW. Thank you for all our panelists, all the students, Dan, Jamari, Jermaine, really appreciate y'all. Jessica, you're incredible. Thank you to everyone. Please check out the ICW website. Please check out Reform Alliance website. Please check out PUMA. Big thanks. And we'll continue the discussion. If you have questions that you didn't get answered, we're sorry about that. But we'd love to continue the discussion. My email is ffelicianot@InnerCityWeightlifting.org. And so I'd love to, you know, continue the conversation, and we'll make sure that your questions get answered. Once again, thank you. And I appreciate it, man. You all be safe.
All right. Thank you.
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 Great work, Feliciano. Thank you.
Hey,
Bob.
Bob, thank you, man. Appreciate it. Have a good
Yeah,
night.
glad-
Be
glad I was
safe,
here.
Bob.
Thank you. You too.
All right.
Bye-bye.
John, Ian, nice to see you guys. Been a long
Andrew.
time.
See you. Thanks for joining.
Thank you. Take care, everybody.
Thank you.
Guys, you already know. Y'all be safe, man.
D, man,
Good
be
to see you.
safe.
Good to see you,
Good
Dan.
job, man. Appreciate you.
Miss you, bro.
You know that.
Dan, thank you, man. Appreciate you.
Definitely just see y'all soon, hopefully.
No doubt.
Hi, Dan.